Chaitanya, speech language pathologist from Pinnacle Blooms Network, Suchitra Vark.
And this is Jerome Edwin, occupational therapist from Suchitra Vark.
Today we will be talking about oral sensory processing. So as we all know, there is sensory receptors in overall body. So today we will be mainly focusing on the oral sensory processing. So first thing what we'll be discussing is the definition, like what is oral sensory processing, then what causes oral sensory processing disorder, so in which individuals we can see oral sensory processing disorder, and symptoms of oral sensory processing, diagnosis and treatment.
Okay, fine. So oral sensory processing is nothing but like similar to oral motor thing as well. How oral motor is important as well, like oral sensory processing is also important. So both are interconnected. So what is oral sensory processing? So basically oral sensory processing is the recipient, like the receptors. Mainly mechanoreceptors will be receiving the stimulus in the oral cavity, and it will be sending the signals to the brain through the sensory nerves. So if any lesion found in sensory nerves, even like it will be affected the oral cavity, the inner interoral region, and even pharynx and larynx. If it is affected, then it will be showing the difficulties in doing the manipulations, I mean oral movements inside, and even the sensory things as well. So like mainly mechanoreceptors plays a major role here.
As we all know, there are structures in the oral cavity, like we start from lips, teeth, gums, tongue, palate, and soft palate. So when we talk about all these things, each and every structures of the oral cavity is distributed with the receptors. So whenever there is a stimulus or external stimulus, so these receptors will send input. I mean our stimulus through the mechanoreceptors, and this will be processed by the brain, and that's how we respond to the stimulus.
Okay, fine. So we'll see based on the conditions now how sensory stimuli is impacting, like how the conditions impacting the sensory stimuli. So if you are taking sensory processing disorder, so first I will explain the sensory processing disorder. So basically, the child, it will be found in child, either it could be congenital as well, and even environmental, it could be adapted. So first thing would be like the children might face difficulties in sending the sensory stimuli towards the brain. Okay, like whether it could be the discrimination problem, modulation, or like there will be a lack of due to the lack of sensory. I mean, due to the lack of the motor things, the sensory also has it could be affected. So, like sensory processing disorder basically divided into sensory modulation, sensory discrimination, and sensory motor-based disorder. Okay, under sensory modulation, we'll see like under sensory modulation, the either sensory stimuli could be over responsive. The child may do a over responsive or under responsive, or they may seek the particular sensations. So that could be like the major difficulty among them. Under sensory motor thing, like they will be suffering from the dysprasia, particularly there will be a lack of coordination, there will be a lack of movements while receiving the sensory stimuli as well. Like sensory discrimination, there will be the child may facing the difficulty in discriminating the like sensations, tactile, gustatory, olfactory, vestibular, and not vestibular, proprioception as well. So these are the things majorly child will be affecting from sensory processing disorder.
As we discussed about the coordination, that dyspraxia will be there. So these kind of, when there is improper coordination, the articulation will also be affected. So that patient who is having this kind of dyspraxia, there will be problem in the speech, like clarity of the speech will be missing. So different kind of approaches will be given to treat all these kind of individuals. So which kind of individuals are getting affected by the sensory processing disorders? Mainly it mainly affects child. So it is like it can be acquired, maybe due to a premature delivery or any kind of there will be normal nerves in the body, but the nerves will not be working properly. There will be impairment in their physiology, and in individuals like whoever is having any kind of head injury or cerebrovascular accidents or any kind of loss of sensations like a facial nerve palsy, and in this kind of patients we can see the sensory processing disorders.
Yeah, fine. So like under sensory processing disorder, I said like earlier before, the sensory stimuli will be either under responsive or over responsive, or sensory craving. So, for example, if the child is being over responsive to the certain texture, temperature, or the taste, okay, they will be the response will be over under over at the average level. Okay, so they will be the response will be too much towards the sensory stimuli. Like we need to assess the things how like they are being triggered under different circumstances, and we need to set a treatment protocol. Like the same mannerism will be followed for over responsive, under responsive, and craving as well, and even in the discrimination problem as well.
So, what all symptoms can we see in over responsivity, like a
Yeah.
hypersensitivity?
Okay, fine. So, like, if the child is being over responsive towards the certain stimuli, means they will be even the food aversion could be there. Okay, the
Okay.
food aversion could be there because they don't like it, because the response they are being sensitive or sensitive towards the certain stimuli, so towards a certain particular food might be. So it will be the food aversion will be the major symptom among them.
As in kind of gag, vomiting, like that,
Yeah,
or
if
they
the
will be avoiding
sensation,
particular
if
textures.
they are being over sensitive towards the larynx and pharynx level, okay, there will be a gag reflex, and there will be even vomiting behavior and sensation as well.
So, can we also see a particular avoidance of the utensils or any kind of taste they are avoiding, textures they are avoiding,
Yeah, it
or
could be. Yeah,
say it? Yeah, it cannot. It can be
Yeah,
seen.
it can be seen actually. Even the utensils or the environment, even they plays a major role for the reason behind why they are avoiding the particular thing, avoiding the particular food texture. It could
Okay.
be not only the food texture, it could be like food taste as well and temperature as well.
Okay. So in the case of adults, like there is a loss of sensations can be there due to maybe the nerve impairment. So we can see any kind of they are not able to discriminate between the taste. They are not able to discriminate between the temperature that we are applying. For example, if we put cold and hot, and we are asking them to sense it, close your eyes and then say what which kind of stimulus we gave. Now, like, they have to comprehend it. They have to understand is it cold or hot, or any kind of sweet or salt. They have to discriminate between these kind of textures or taste, and then this will be very helpful in the diagnosis too.
Yeah. So I said right, food aversion. How we can differentiate food aversion among the kids who are having sensory problem and among the normal kids? How we can differentiate? So the if the child is being showing the food aversion, if the child is even like having the food that I mean the objects inside their mouth, they are not feeling difficulty to put the objects inside their mouth, but they are refusing to take the normal food. If it is so, like they will be suffering from the sensory problem particularly. If the child is being avoiding the food and the object as well, then they are not suffering from the sensory problem. Mainly sensory oral sensory disorder, oral sensory processing as well.
So in diagnosis, what do you do? What we do mainly is that, right, starting from the case history. For example, we should know what is happening, what triggers them to do all these things. Whether if it is a child, we have to start right from the birth history, just to know whether is there any premature delivery. If there is a premature delivery, there can be abnormality of the structures in the body, and is there any kind of like intubations which was there for a longer time in their body, intubation which also leads to lots of sensations in the oral cavity. So these kind of things should be assessed right from the case history, and we should also assess the kid with the different consistency of food. For example, starting from the liquid, semi-solid and the solid, we have to give each consistency food to the kid, and then see how they are responding to the particular consistency. For example, is there any nasal regurgitation or any kind of aspiration, or their facial expressions are changing, they don't want to take such particular kind of food inside their mouth. And also, this is also necessary to understand why this is happening, so that we can set our treatment protocols according to that. And also introducing them with a different texture food and different sound making food also will help them, biting, chewing, and how all these are happening in their body. Mainly when I talk about the movements of the joints, there comes the proprioception.
Yeah. So proprioception, like if they're having the difficulty in proprioception, they won't understand. They won't like what's happening inside their mouth. There could be like food dropping while they are eating. There could be like leakage of the food if it is in liquid manner. Okay. So one more point I would like to add. Like if the child is being hospitalized whenever they are under the incubation period or hospitalized, mostly they will be feeding in the tube. Okay, so they won't be exposed towards eating using the oral cavity. So that is a time they lack these kind of oral things. So that could be also one of the reasons to have this kind of oral sensory processing disorder as well.
That's why we mainly start with the feeding milestones also. We should know when the parent is introducing particular kind of food to the kid. So there is a feeding milestone. We should assess by each and every step how this is happening. Early introduction of particular kind of food or too late introduction of particular kind of food can also create such problems.
So it has to be in the appropriate age when to introduce all kind of
So mainly in the case history, we should ask the parent like when they introduce particular kind of food and how the kid was responding to the particular kind of food. Were they like is there any tantrums they were showing, any kind of anger, annoyance to the particular kind of food? Whether they by looking at the food itself they are showing particular kind of tantrums, or while taking such kind of food inside the mouth while feeling the textures they are showing the particular kind of tantrums, we should assess. Along with it, like these kind of issues can also lead to the feeding problems also, which comes under dysphagia, which can, like if there is any aspiration or something, we can go with the other kind of diagnosis using like barium swallow test and all. So in this case, these kind of cases will be dealt with the speech therapist along with the occupational therapist. Mainly a multidisciplinary team will be needed to diagnose such patients.
So not only like speech pathologist and occupational therapist, is there a chance of like behavior therapy needed for these kind of kids?
Any kind of tandems. For example, without any aversion or any kind of oversensitivity or something, the kid will simply avoid particular texture of food only. They will definitely not try to eat food. So in these kinds for like we can also include a behavioral therapist in our team.
Okay, fine. So what do you think, like the oral muscles plays a major role for speech, or do you think if the stroke patient, like for example stroke patient, if the muscle, if it is in a plastic state or hypotonicity, what will be the treatment protocol from speech pathologist?
So as in if the oromotor things are affected in an individual, means like we should assess first the thing why it has happened. So after assessing, first we should see which kind of movement is not there in the particular individual. First we should start right from the lips, then see the tongue movement, cheek, and how the muscle, whether it is like the way you said, whether it is hypo or hyper, like that we have to see. So according to that, the treatment protocols will be set. For example, giving particular exercises just to stimulate the cheek muscles, lips, like protrusion, retraction, and massaging over the cheeks, and also putting the tongue in the different positions like elevation.
Help them? Will tapping technique?
Tapping technique, mainly we use it like during massages. Sometimes we tap to maintain the tonicity of the cheek muscles, and mainly we do such massages inside the oral cavity also. So we do it and we put the tongue in the different positions like lateralization, elevation, depressions, and also protrusion and retractions of the tongue. So this will also improve the movement of the oral structures, and which will also be helping in feeding also, and also to speak with a coordinated movement. So because since the speech is fully depends on the coordination of many systems, and since the articulators has to work coordinately to put a clear speech, this oromotor exercises will mainly help them. Or in children, if we are mainly dealing with the children or something, we cannot simply say do those exercises and all. So we can put some interesting sort of activities like blowing, sucking, biting different textures, and blowing balloons, blowing bubbles, clicking, and making asking them to make alternate oo exercises, putting them in front of the mirror to manipulate their facial grimaces.
Okay, fine. So there are even more sensory components like oral stereognosis, oral kinesthesia. So what is your idea about oral stereognosis?
So oral stereognosis, mainly what the detection, the person, whether the individual is having the ability to recognize the different forms, as in putting shapes, and then asking them to recognize which kind of shape is introduced to their oral cavity.
You're telling like manipulating with tongue movements, jaw, everything?
Yeah, mainly it will be tactile. They have to feel which kind of shape is introduced to their oral cavity and then name it. Maybe with the eyes closed, like the way we do it at the oral, stereognosis with the tactile in the hands and all, no? Yeah, like that.
Similar thing in the inside of the oral cavity.
So what do you think about the 2-point discrimination in the oral cavity?
Yeah, so the 2-point discrimination, like what we would, how we would test in the hand means like in hand or arms anywhere. So at the simultaneous manner, okay, the two triggers will be given to the child in like when the eyes is being closed in a closed manner. Okay, so they need to identify whether the stimulus is 2 or 1. If they are able to identify the two stimuli, then the 2-point discrimination is okay with them. The same manner happening inside the oral cavity as well. The two ends of the particular object. Okay, if they are perceiving it, then 2-point discrimination will be okay with them. So there is no need of giving those sort of.
I think the same thing works with both adults and children.
Exactly.
Because in adult we said when we were talking about the facial paralysis and other strokes and all, so there will be a loss of sensations in their oral cavity. They are not able to sense the taste or the temperature. So we can use these kind of technique to improve their sensations also, right?
Yeah, fine. So the one more component is oral kinesthesia. Here, the awareness about the joint position, joint movement. Like if they are perceiving these jaw contour, what they are doing, they need to be aware about the movements like jaw contour, jaw movements. Then it will help in their like chewing, this kind of a thing. So if you are lacking those components, we need to do sort of a treatments like mirroring. These kind of things will help them, right?
Yeah, because putting them in front of a mirror, making them sit in front of the mirror, first will give them a visual stimulus, which will also motivate them. For example, if they are making different kind of facial grimaces, like which is not appealing when someone is looking from outside, we can put them in front of the mirror and then say that you should not do all these things. Like when, so for some kids, what they will do is that while introducing a particular kind of food inside their mouth, they will show their faces like in a different facial expression.
So would show a sample of it.
Yeah, demonstration therapy will work a lot because sitting right in front of the mirror, both the therapist and the child will be sitting in front of the mirror and they both will be having the same food and then showing the facial expressions like, see how am I eating this food and what should you also do? You should also behave like this. Like it's like a kind of motivation along with that reinforcement can also be given.
So they need to follow just by seeing the therapist or caretaker, right?
Yeah, so these things, once when we are introducing the food that they are not liking, for example, some kind of food they will be avoiding, we say. So when this is happening, I think this will be better when we are introducing these kind of food without their knowledge, like in a different textures or something. What do you feel about those things?
Yeah, the one more thing is like if they are feeling kinesthesia, if they are having struggling to imitate. So here, occupational therapist would do passively. Therapist, not actively. They will just passively do jaw movement like this and opening, closing passively. Then they will understand the movements. Okay. So then they will practice and gradually it will be transferred into active assistance and completely at last active.
So we already have, every time we have this doubt, like while introducing a particular, I heard that a particular child is avoiding particular texture food. They are not taking it. So how do you think we can introduce this to the kid?
So if it is, if they are particularly avoiding the hard texture or soft texture means, then we need to make the form of a texture. Like we need to grind it, like if it is solid means we need to make it semi-solid.
Okay.
Then we need to introduce them gradually and they will be habituated and taken easily in a particular place.
So what will be the advice, like the nutrition things that we suggest the parents to start at home, like while they are coming to the therapy? We can also say this, since we already said that there will be feeding delay in the feeding milestones or something was too late or something was too early that they have introduced. So I think giving them a proper schedule, like how to start with the things, will be helpful.
Yeah, fine. So here dietitian will play a major role. For example, like if the child showing food aversion towards milk particularly, milk is the biggest source of calcium, right?
Yeah.
So we can't avoid as well. So we need calcium particularly for kids because they are growing. So we need to, like dietitian will go for alternative things like what are the calcium rich foods rather than taking milk. They will go for it. So dietitian will schedule they give the diet alternative to milk. So here occupational therapy is like make the milk into other format, like making a milkshake, other kind of a taste with the flavors. They can add some flavors and that will be like if they are if the child is being if they are favored towards what strawberries, this kind of flavors, now we can add strawberry milkshake. That's all. Like they will be habituated to taking milk.
So gradually we can reduce.
It happens. It happens gradually, not in, all of sudden. It happens gradually, and even it can happen very slowly as well.
So what can we do in the case like when the kid is avoiding the food by looking at the food itself? Some visual thing is there. They are not. The food is not appealing. They are not able to eat it. They doesn't.
Just we can
they don't
identify
want
just
to eat
by
it.
the facial grimace, right? Just expression. Okay, here cognitive behavior therapy. Here psychologist plays a major role here. So the introduction of food, it could be like there's a less chance of having sensory problem here. There could be behavioral problem as well. So the behavioral therapist would analyze the thing, what triggers them to avoid the particular food item, and they would form a treatment protocol like behavior therapy, cognitive behavior therapy. Like they will condition them and they will make them habituated to taking this certain food.
Yeah, I heard this like when this happens with adults.
Okay.
Maybe like I heard that like when adults are having some kind of congenital from their childhood itself, they had a problem with the sensory processing. They had problem with particular textures. I think eventually without taking therapy, they will learn some coping strategy, it seems.
Yeah.
So avoiding such certain foods. When they are going out with their friends or something, they will avoid certain foods and then take some other texture foods or food having some other taste. They will be doing and some kind of coping strategies also.
Yeah.
So when they are sticking to the coping, can we help them with the therapy to start with the?
Yeah, of course. Here as well, it is completely the brain is conditioned. They are habituated to a certain manner. They are habituated to certain behavior. So here as well, psychologists, behavior therapy will plays a major role for them. For particularly adults, they are being avoiding right from their birth.
Okay. So this is the about the oral sensory processing and the oral sensory processing disorders and how does a healthy oral sensory processing happens in the body. Next time we'll meet you with the another interesting topic. Thank you.
Thank you so much.
Pinnacle Blooms Network ప్రపంచ వ్యాప్తంగా స్పీచ్ డిలే, ఆటిజం స్పెక్ట్రమ్ డిసార్డర్, కాగ్నిటివ్ డెవలప్మెంటల్, సైకలాజికల్ రుగ్మతలతో బాధపడుతున్న దాదాపు 80 కోట్ల మంది పిల్లలు మరియు పెద్దల జీవిత ప్రమాణాలు మెరుగయ్యే విధంగా దశాబ్దాల రీసెర్చ్ తో కూడినటువంటి అత్యంత ప్రభావవంతమైన స్పీచ్ థెరపీ, ఆక్యుపేషనల్ థెరపీ, బిహేవియరల్ థెరపీ, సైకలాజికల్ కౌన్సిలింగ్, చైల్డ్ డెవలప్మెంట్ మరియు రీహాబిలిటేషన్ సర్వీసులు అందిస్తున్న ఏకైక స్పెషల్ ఎడ్యు హెల్త్ కేర్ సంస్థ పినాకిల్ బ్లూమ్స్ నెట్వర్క్. ప్రపంచంలోనే మొట్టమొదటిసారిగా మిరాకిల్ అనే పేటెంటెడ్ టెక్నాలజీ సహాయంతో అత్యంత పారదర్శక థెరపీ సర్వీసులను అందిస్తున్న ఏకైక సంస్థ పినాకిల్ బ్లూమ్స్ నెట్వర్క్. 100 మందికి పైగా నిష్ణాతులైన థెరపిస్టులతో మీ మరియు మీ పిల్లల బంగారు భవిష్యత్తు కొరకు పాటుపడుతున్న సంస్థ పినాకిల్ బ్లూమ్స్ నెట్వర్క్. భారత ప్రభుత్వ ప్రతిష్టాత్మక స్టార్టప్ ఇండియా అవార్డు పొందిన భారత్ హెల్త్ కేర్ ప్రైవేట్ లిమిటెడ్ యొక్క అనుబంధ సంస్థ.